I'm going to talk about cesarean scar ectopic pregnancy. Now, a cesarean scar ectopic pregnancy is a pregnancy that's implanted on or in the scar from a previous cesarean section. And this is an early pregnancy here. This is the fundus of the uterus, the bladder, the lower part of the uterus. This is the cervix. This would be the location on the uterus where a previous cesarean scar is typically located, which is in the lower part of the uterus, lower segment. And you can see there's a defect there in the uterine wall, and the pregnancy is implanted in that scar. But it can also be implanted over the scar where the thickness of the uterine wall is still intact. The reason why it's called a cesarean scar ectopic pregnancy is because the pregnancy is not located in the endometrial cavity, which is where is not intrauterine in the endometrial cavity where an intrauterine pregnancy would be located. So that's why it's called ectopic pregnancy. But there's some providers who will just refer to it as cesarean scar pregnancy. Now, CSPs, cesarean scar pregnancies, are associated with high morbidity early in pregnancy, and that includes hemorrhage, uterine rupture, placenta accreta spectral disorder, and it's also associated with high maternal mortality. However, there are some CSPs that can continue to a viable gestation. Now, there are published criteria for diagnosis of a cesarean scar pregnancy. Now, options for management of a CSP depends on whether or not the patient is hemodynamically stable. If they're hemodynamically unstable, meaning bleeding, their vital signs are unstable, they're having complications, sepsis that can occur as well, then a procedure has to be done to end the pregnancy and save the patient's life. If the patient is hemodynamically stable, then the options are to do conservative management and continue the pregnancy, or to have an abortion procedure to end the pregnancy. That decision is made after thorough evaluation of the pregnancy, the patient's medical history, complete discussion of the risks and the benefits to allow the patient to make the best decision for their care. But at the end of the day, patients have the right to choose either option, should have the right to choose either option if they're hemodynamically stable. When people get on social media and talk about cesarean scar pregnancy and that it can be saved, that it can be managed expectantly, I want people to know that that is a very small percentage of patients, very small percentage. And I don't want anyone thinking that if they receive a diagnosis like that a good outcome is going to happen for them. That is the danger of social media. People like to get on social media and scenarios such as this and talk about all the good things about it and their good outcomes. Not so much when the outcome isn't good, especially if they're not here to talk about that negative outcome.